Our award is to investigate clinical decision-making in the receipt of coronary angiograms in patients with heart attacks, as well as patients with stable coronary artery disease. Coronary angiograms are a procedure used to visualize narrowing of the arteries around the heart. If you see a narrowed artery and it's an appropriate situation, you can go in and reopen it, and you can see the blood return. Sort of an immediate impact. The benefit of that is you do that properly and you do that in a timely fashion, and the damage to the heart is lessened. So not only have you prevented death, but you prevented disability. Our previous research has shown that there's some perplexing patterns of overuse and underuse, and the award will let us go down to the ground, speak to cardiologists, understand how they make their decisions. It's about when to use this procedure most effectively or most appropriately. Now, that has a direct impact on the patient, the family, all of us, but also on the future of the health system. We found, using all 13,000 heart attacks in Victoria in the last year, that those people who did have an angiogram, their survival rate was 3 times as high. So we think about 40% of all hospital deaths for AMI could be prevented. The Bupa Health Foundation Award is going to let us take what we found at a very high population level and go down to the coalface to understand how the cardiologists are thinking. We'll use the factors that are in common across the doctors, the cardiologists, in individual hospitals, develop an instrument, and then go back to charts of patients in that hospital, and then actually try to understand how often these factors that they've mentioned actually have impact on the ground in their decision-making. We're not going to be able to change the health system, make it more effective, efficient, getting care to the right person, unless we understand what they're thinking that goes on. That's what this award would allow us to do.